like I said earlier, the serving size in the dietary supplement world that is scientifically based. We have completed this year 3 clinical trials, phase 1 clinical trials, in human beings with essential oils. And I'm now going to show the data to you. I hope that you get it better than the last group did. So if you're not listening, because I had to stop and pause because nobody got it over there the first time, so I want to make sure everybody's listening. I'm going to take you through the protocol right now. So the study protocol is that we gave patients 3 different essential oils. The first was the turmeric duocap, rolled out at this year's convention. The second was the copaiba soft gel, rolled out last year. And the third was the lavender capsules that we created. These 3 essential oils are foundational products for us, and I am now going to show you what happened to the main chemical compounds after each human took these doses, and we measured at all of those times listed that chemical in their blood. We analyzed their blood for the maximum concentration, the minimum concentration, and then the half-life in between. That half-life is how you calculate a dose. 3 to 4 half-lives usually constitutes a dosing period, because it takes 3 to 4 half-lives for a dose to fall to nothing. So, listen, this is important. When we fall by half of a concentration, so if I fall from 1 part per million to 0.5 parts per million, that is a half-life. The amount of time it took to fall that distance in the blood is a half-life. Okay? Who wants to see the data? I do too. I'm really excited about this stuff. All right. Turmeric duocap half-life data. So we gave patients turmeric oil only on the left, and then we gave patients curcumin powder on the right. And then a third group of patients took the turmeric duocap. How many of you are nerdy enough to know that curcumin is not bioavailable? Raise your hand. Okay, so you all know that curcumin is not bioavailable. I just set that up, so just stick with me. So the first graph shows you the turmeric oil's half-life. Let me show you those graphs. That didn't quite transfer to this computer. But the half-life of turmeric is 9 hours. The half-life of curcumin is 14 hours. But if you look at the y-axis on curcumin, do you notice that those numbers are really, really small? That's because the bioavailability is poor. When we gave turmeric and curcumin together, the bioavailability of the curcumin rose 11-fold. Wow. All right, so you now have a product that makes the chemistry that is so powerful in curcumin bioavailable, meaning that it gets into your blood and can go do all of the things that we talked about yesterday. Without it, it doesn't work, folks. You're taking curcumin powder and it just doesn't work. It transits right through you. This is incredibly important data. This data is the very, very first in the world pharmacokinetic trial on a whole essential oil botanical products together. The only one that's Second, copaiba. You ready for copaiba? Yeah. All right, so let's look at some beta-carotene data. So beta-carotene, as you know, binds to the CBD2 receptor. And this curve looks quite different from the last curves. This curve has 2 phases. There's a steep drop-off that you see first, and then there's a much slower drop-off. Phase 1 is a 2-hour half-life. Phase 2 is a 12-hour half-life. Those 2 curves get averaged together to give us our half-life of 7 hours when we average those 2 slopes together. So the half-life of copaiba is 7 hours, thus supporting a once-a-day dosing regimen or serving size regimen for copaiba. Very similar to the numbers that we talked about for turmeric. I realize I didn't say that to you before. The same Q-day dosing. I guess you guys don't know what Q-day means. Daily dosing, once a day dosing for the turmeric dual cap, and once a day dosing for cobaiba. And now, how about lavender? Do you want to see lavender?
Yes. Yes.
Okay, so lavender is, for me, the coolest one of all.
Awesome.
So check out lavender's half-life. We looked at linalool in the blood. I'm only showing you this much of the data that I have on lavender because I can't show you the rest yet. It's that exciting. I'm really, like literally, they wouldn't let me show it because it's really, really cool. But I can talk about it. So lavender, the linalool half-life is 1 hour. Do you see that really steep climb and then steep drop? Linalool leaves the bloodstream really, really quickly. I am not going to give you dosing recommendations yet. There will be more to follow on our serving size recommendations for lavender as we analyze more of this data and bring it to you. This data is literally last week.
Woo.
So I'm really, really excited to share it with you. So what does it all mean? I've just shared with you 3 clinical trials, phase 1 clinical trials, never been done before on essential oils. What does this mean to you? What does it mean to you? Well, let me show you what it means. Whoops. Oh yeah, there we go. So what it means is that you now have products that are built upon a foundation of phase 0 clinical trials, standardization or consistency work that dōTERRA has been about with CPTG for the last decade. Now we have taken 3 different products to phase 1 clinical trials. I put peppermint in here because peppermint has some clinical trial data on already published. This means that you now have a family of products that are based on clinical research, prospectively done. And I'm proud of it. I think that this means something to you because there's a large population of people in the world today who don't know dōTERRA and they think they don't want to. And the reason they don't want to is because they don't understand this type of work, all the work of the last 10 years, and these 3 clinical trials. You need to understand this, and so I invite you to go to the product showcase and talk with our scientists. Sit with them and make sure you understand it, because if you can explain half-life, phase 0 and phase 1 clinical work, it will mean a great deal to a lot of people who would have dismissed you otherwise. It will enlarge your dōTERRA family.